Welcome to this presentation on the social determinants of health on a global scale. My name is Zac Perrington and I am a student at La Trobe University with the vision of becoming a nutritionist in international aid. The last century has seen vast improvements in health and well-being as well as a dramatic increase in life expectancy. These improvements can be attributed to advances in healthcare technologies, better living conditions and improved food and water quality, all leading to a reduction in infectious diseases. However, these benefits have not been distributed evenly around the world. As a worldwide population, our health is improving as a whole, but the gap in health outcomes between rich and poor countries, high and low socioeconomic groups, and urban and rural communities has widened. Social and structural determinants significantly influence health at a global level. These are known as macro-level factors and include such elements as economic, political, education and healthcare systems, regional trade agreements, and climate change. Communicable diseases that cause pandemics such as the Spanish flu, SARS, tuberculosis, and the recent outbreak of COVID-19 are social determinants of health that affect us all on a global scale. HIV/AIDS is an example of how an infectious disease can affect the health of the global population, requiring action from multiple sectors outside of health. HIV is a retrovirus that infects immune cells. If a person's T cell count drops below 200 cells per microliter of blood, they are usually diagnosed with AIDS. Whilst infection rates are decreasing globally, some countries, particularly in Eastern Europe and Central Asia, are still experiencing upward trends of HIV infections. Southern Africa is the most HIV prevalent region, with over 15% of the population infected with the disease. Women and young people are increasingly affected by HIV/AIDS and is the leading cause of deaths globally for women aged 15 to 49 years. In lower and middle income regions, particularly in sub-Saharan Africa, complex social and structural determinants including culture, gender inequity and poor living conditions impact young girls more so than their male counterparts. It can limit their access to education and subsequently employment, income and healthcare. This could also impede their HIV prevention awareness and may be pressured into sex work, putting them at high risk of HIV infection. Non-communicable diseases, or NCDs, account for nearly 2/3 of all deaths globally. Many low and middle income countries are forced to endure a double burden of ongoing infectious disease epidemics and rising rates of NCDs. Poverty and poor living conditions make people more vulnerable to NCDs and put them at higher risk of premature death. Communicable and non-communicable diseases place a heavy burden on household income, as sick people may not be able to work and rely on others for extra support. The loss of income increases the exposure to risk factors and the risk of disease, which can lead to families and communities becoming trapped in a cycle of poverty and disease. Inequities in health are emphasised by the unequal distribution of political power, money and resources. Globalisation can assist in economic growth and reduce poverty, but it can also create and worsen inequities between rich and poor countries. One factor driving global inequities is the third world debt. Many poor countries borrowed money when interest rates were low, but have not been able to pay it back, further crippling their nation's financial situations. In 2015, the United Nations established the Global Goals for Sustainable Development, designed to reduce poverty and global inequities by 2030. It sets 17 goals and calls for multi-sectoral action to achieve them. Thanks for watching this presentation.